Hi, this is Erica from Muckle Mama on Fire, and on my channel I talk about my path to financial independence as it intersects with raising a child with special needs. In this video, I'm here to declare that early intervention works. 2020 marked the first year my son received applied behavior analysis therapy, and I'm glad to share a review and the outcomes of that experience for him. So here's my beautiful son. I'm going to share some details of his initial diagnosis and where he was before ABA and after ABA as a part of his review. So he was diagnosed officially through a neuropsychologist in October of 2019 at the age of 3 of being on the autism spectrum. When I initially went to get that evaluation done, as many mothers, I believe, who find out their child is on the spectrum, you believe for a year or so prior that something was maybe a little bit different about your child. They weren't necessarily as talkative as what you may have seen in other children. They may like to stem, as they say, and move their hands like this, or spin and twirl, or just have a whole bunch of energy. And from what I gathered and thought what autism was, I thought he may be on that spectrum. Then I had to become an advocate for him, really, and push the insurance to please say, I want to get him evaluated just to see if he really is on this spectrum and how we can best help him. So I'm thankful that I followed my initial inclination that something was a little bit different, and I pushed towards getting him fully officially diagnosed. As I learned, and I want to share to other parents as well, once you do get the initial diagnosis, so many doors actually open for additional services for your child. And I was really blown away and amazed by that, by having that initial diagnosis, how it opened to getting the intensive treatment for my son to bring him up to speed to where he really should be based on his age. So he was initially diagnosed in October of 2019 at the age of 3. He started ABA therapy in January 2020. The therapy plan was an intensive program. It was 30 hours a week, so that's 6 hours a day, 5 days a week. So here are some of the exhibited behaviors he had before ABA and then after. So he did not have functional language. So by functional language, he wasn't able to tell me what he needed or wanted. He would point, grunt, and use adults' hands as tools to get desired items. So for example, say he wanted a banana. He would go into the kitchen, he would point towards where the banana was sitting, he would grunt towards it, he will take my hand to actually put it on the banana to actually get it and to open it. He did speak, he was somewhat verbal, just wasn't functional. So he spoke in like nursery rhymes, memorized sayings he heard from TV or around us. He loved the alphabet and he loved numbers. So he would just spontaneously, say the alphabet, say a string of numbers and nursery rhymes and such. He did not say mommy and daddy. He would cry or be frustrated at not being able to communicate with us. And in turn, I would cry and be frustrated because I couldn't communicate back to him. And he was not potty trained. At the age of 3, and oftentimes people look at you and like, okay, why is your child not potty trained and he's 3 years old? But one, he wasn't able to communicate when he had to pee. And we would try, several times, like, and we put him on the potty and it would work, but it's just something that wouldn't stick. And for us, like, I didn't know ways for him to communicate to me that he had to go. So he remained wearing pull-ups at that time before ABA. 1 year after ABA, I am just happy to report, that he is able to ask for help and identify what he needs and wants. So he can say, Mommy, can I have a banana? I have to go potty. I want to go outside. I want to play basketball. Like he really loves sports. He's actually able to speak in full sentences. And it's something that just, when me and my husband, we see it, it just warms our heart. We just smile and almost want to cry. When I tell you, when he first called me Mommy, I'll never forget that, because I came to pick him up from school, from the therapy center. And he said, Mommy's here. He's like, my mommy's here. And I just couldn't believe it. I didn't cry at that moment, but definitely in the car I did. So it is something that you just cherish. And oftentimes too, for those parents who don't have children on the spectrum, it may be like hard to believe, like what, like when you first hear your child, typically you may hear when they're maybe between a year old or so, year to 1 or 2 years old. So to go into 3 years and some months and not hear the word mommy, and to finally hear it, and now he says it all the time. That doesn't bother me, it doesn't nag me at all. I love hearing him call me mommy. That's like one of the best things. He's able to say and identify the names of his aunt, his grandparents, and his therapist. So he has a favorite therapist that he has, and he says her name all the time. He loves Miss Blank. And all the teachers there he just loves. He knows his name. So now he's able to say, hi, no, my name is Blank, right? Or we'll say, what is your name? Before he wasn't able to answer questions like by the doctor. So the doctor will say, what is your name? And he'll just kind of look around, not necessarily able to answer that question. How old are you? He wasn't able to answer that question. Now he's able to say, my name is Blank. I am 4 years old. This is my mommy. So, and this is all in just in 1 year of being in applied behavioral analysis therapy. So he's able to know his name. He knows how to write the name. He's currently practicing actually writing the name out on paper. It may not be a full line like you would say like in that regard, but he's able to write his name. Like he was able to write it. He knows the alphabet so well, and he can read. He can read books. Surprisingly to me, like as we're driving down the road, he'll spontaneously just read what's on the street, read the buildings, read the billboards, and he actually will read books. So we have some books that we read as well. And I'll give a quick plug to Preschool Prep. If you haven't heard of them, check them out. He's learned so much from their online programs they have, but also their books. And now I can happily say he is potty trained and he rarely accidents at night. I still have him wear pull-ups at night just in case, but it's always dry in the morning. So this is all in 1 year of ABA therapy. And in regards to ABA therapy, it takes a team. It no doubt takes a team to see these changes in your child. And I'm happy to share some of the team members that we had on my son's team. He had a board-certified behavior analysis. He had a registered behavioral technician, a speech pathologist, as well as an occupational therapist. And they all serve, of course, different domains within how they design his treatment plan. But the board-certified behavior analysis, or known as BCBA, they pretty much oversee the care team. And he works mostly with the registered behavior technician. He'll occasionally meet with the speech pathologist to help him in clearly enunciating his words, be able to communicate in that way. And the occupational therapist helps with his everyday living skills in that sense. So being able to, brush his teeth, that they help along with the RBT to get him potty trained very well. So this was the team that my son had. And now I really want to share with you quickly ABA in action. So here is a video of my son with his most favorite RBT. Let's see, hopefully it comes up. Let's see. Okay, I think it's coming. So as that comes up on my computer screen, it's going to show you him working with his registered behavioral technician as they go through a routine. Just to give some context more, he had just finished doing like a painting project. So he has like a little paint on his hands. And most people who have kids with autism, they can get fixated on certain things. So he had like a little bit of paint on his hand as they were doing this. So I want you to notice how the RBT was able to kind of redirect his focus. Okay, it's coming.
Good pointing. Excellent job, Roman. Give me the strawberries. And I wish they were so hungry. Point to the bicycle. Nice job. Perfect, Roman. Alright, what's the shape?
Triangle.
And the color?
Red.
Red! You can put the red triangle in, my dude.
You're
Do
trying
you want to show you the toothbrushing again or anything?
We could.
Yeah, I can do toothbrushing one more time. Nice. What's the color? Color is? The color is yellow. Yeah, color is yellow. Stomp your feet. Good. I know you got paint on your hands. We can wash it off. What color is it? What color is it? Yellow. Good job. What's the color? Good job. And the shape? Good job. You can put the rectangle in. Yeah, we're going to wash your hands. Go ahead. Put the rectangle in. Yeah. Nah. That one was a yes, though. Nah. Yeah, that one. Yeah, thank you. What's the color? Color's blue. Can you show me waving? Good. What's the color? Blue. Thank you. We're going to go brush teeth one more time, and then we're going to...
All right, so that was a clip of my son there, and that's a recent review he had with his RBT. So given the intensive nature of delivery of ABA therapy, the cost of treatment can be exorbitant without adequate health insurance. I am fortunate that my employer coverage paid 90% of the treatment cost and 100% after it reached my out-of-pocket max. So what was the cost of 1 year treatment? So I blocked out some of the details, but I want to highlight this. The total bill for so far 1 year, this is not even including the month of December, $71,998.25. My insurance paid $49,633.33, and my out-of-pocket portion was only $2,150.35. And this really just shows truly like the cost of intensive ABA therapy is high. It really is exorbitant in the U.S. And without adequate insurance, this is where a lot of advocacy needs to be done for all of us to be able to afford this care for our children, to see these kinds of impacts and changes in them over time. So in the future, my son will continue ABA therapy all of 2021. We anticipate enrollment into a special education kindergarten classroom for school in the year of 2021-2022 for the school year. And I thank you for taking time to look at my overall review of ABA therapy for my son in 2020. Please do like, share, subscribe. Tell me in the comments, how has ABA therapy impacted your child's life? Please do note in the comments that answer to that question. Also, other topics you would like me to cover in the future. Thank you for watching. You can find me again on Instagram at Mocha Mama on Fire. And I look forward to engaging you in the video soon. Be blessed. Bye.